Um, there we go. We're live. Thank you, Dr. Savoy, for being here today and chatting with us this afternoon about HPV. So, welcome to the Facebook Live.
Thank you. Thank you. Thank you. Thank you. I'm really excited to be here. I am super grateful to have the opportunity to join you guys today.
Sounds good. So, can you introduce yourself for our listeners really quick, and tell us what you do, and then we'll go right into it.
Oh, I'd love to. So, I'm Dr. Margot Savoy. My primary job is as Senior Vice President for Education, Inclusiveness, and Physician Wellbeing for the American Academy of Family Physicians, which is really big title for really cool things that I really love to do. I'm a board certified family physician. I serve as faculty at Temple University in their medical school and their dental school. So lots of really cool things. What makes me super excited to be here with you today is because one of my side jobs that I get to do is that you get to show up and support organizations and things that make you really happy. And I met Cervivor as part of my work on the American Cancer Society's roundtables. So they actually have two, one that's a cervical cancer roundtable and one that's on HPV vaccination. So we met there. We both have a passion for immunizations and cancer prevention. And so it just clicked. And so I'm really excited I get to be here with you guys today, supporting something that's important to me as a family doc, but also that I know that's really important to you guys.
I know with that long title, you're so busy. So we thank you so much for being here. I mean, I know just even though you're in family practice, you have so many other side projects that you're doing, and I can hear the dedication already. So thank you so much for being here with us today. Let's kind of jump right into it. You're here to talk about HPV, so let's go right into it. I know we've had, it's January Cervical Cancer Awareness Month, and part of that is HPV, right? It's prevention, and so the vaccine. So could you kind of, give us some, the one-on-one about HPV, right? How is it linked to cervical cancer, and what's the importance of it?
Oh, that's such a great question. So HPV is just a shortened abbreviation for human papilloma virus. So it's actually a virus. So it's something that we can catch. We talk about it like it's one virus. So when you hear people talk about it, they just say HPV. But I like to think about it more like a family of viruses. So you got a whole family of viruses, and some of the family members are a little bit problematic. So I mean, some of them are messy. So there's 150 folks in this family. So 150 different types of HPV. Most of them are pretty chill. Like they don't really cause a serious risk to your health. Some of them do cause some things. So, for example, HPVs are known to cause plantar warts or skin warts.
Mhm.
There's some that cause genital warts. So, if you think about the genital warts, they actually are often HPV. There's even a certain respiratory disease where you get these little papillomas, or they look like warts, but they happen inside your lung that actually come from an HPV infection. The problem is that some of those HPVs are super messy. I mean, they're the ones that you just don't even invite to Thanksgiving dinner. Like, and there's 12 of them. They're just what we call high risk HPVs. And the reason they're high risk is because they don't just cause nuisance problems, they actually cause cancer. And then there's two
Mm.
that are just super messy. Like they're the ones that we don't even acknowledge in the family anymore because they're just super messy. HPV 16 and 18. And they're the ones that cause the vast majority of the cancers. So when we talk about HPV related cancers, HPV 16 and 18 are the two that cause the most of them, even though we know that there's others that cause trouble. And so we
Mhm.
care about this because it's not just one cancer. So, I mean, I love that we're talking about cervical cancer today, but it's important to know that you could actually get not just cervical cancer, but oral cancer. So in your mouth, pharyngeal cancer in your throat,
Mhm.
anal, rectal. I mean, men can get penile cancer. Women can get vaginal and vulvar cancer. So all of those in
Wow.
addition to cervical cancer. So those two, 16 and 18, are pretty messy. Like they can cause a lot of issues. And there's some others. Remember, there's up to 12 that could actually cause a type of cancer one way or the other.
Oh, so those are the troublemakers that we just don't want, right? And
Exactly.
and the way that we don't want them and we don't get them is through this lovely not new, but this lovely vaccination, right? There's a vaccine out there that actually helps prevent these troublemakers, right, from making trouble.
I mean, it's such a cool thing. Like, I just think about over the years, the number of times I've heard somebody say to me, gosh, I wish there was a shot that I could get that would stop me from getting cancer. Or, like, if
Mhm.
only there had been a way that I could have prevented myself from getting the cancer. And it just, I mean, it tickles me on one hand because I'm just so stoked. I mean, that's literally what HPV vaccine does. But it also bums me out because we have so many people who don't get access to the vaccine or are not able to get it because they get sort of sidetracked by other conversations and myths and things that happen.
Right.
So it's just a bummer. And so, I mean, the HPV vaccine itself, the one that we have now, we're up to protecting against 9 different types of HPV cancers. So the viruses that you don't get, 9 of them, all in that one vaccine, including 16 and 18. So the 2 that I said are the most messy, that cause the most trouble, are actually included in the vaccine. And then there's others that go along with it. We know that the vaccine is safe and effective. I mean, just this morning, I was listening to NBC News, and they were talking about the updated data that's come out around cervical cancer rates. And I got super excited because it started off, the story started off talking about our 20-year-olds, like so folks in their 20s, and how the rate of cervical cancer in that group has plummeted. It's gone 65% down compared to in 2019, compared to what it was in 2012. And I was stoked. I mean, I'm all excited. I'm like, that's the kind of news I want to hear. And they're like, it's all attributable to the fact that this group was the group that really got mass vaccinated against HPV at a young age. So they just never even got infected. So they didn't even have the opportunity to have that as a problem. And then they went to the second half of that story where they talked about the women in their 30s and their 40s and how the rates of cervical cancer are actually rising in those groups. And then I heard them talk about how other groups, so men, are actually starting to have HPV related cancers and they're not getting their vaccines either. And it just bummed me out all over again because I realized that here we have this opportunity, this vaccine that we know is safe,
Right.
we know that it's effective, and yet we're not necessarily getting it out as often as we could to all the people we need. So I get excited about opportunities like today where we get to talk to folks and just remind them that it's available, remind them that it's out there, that if we get the opportunity to prevent people from getting these infections, that we could go a long way to preventing them from getting cancer. Now, I do always have to pause because one of the things that sometimes happens, and I just think it's important to, I get excited about the vaccine, but sometimes people get overhyped about the vaccine and they think that it means that you don't have to do your pap smears anymore. You don't have to do any of your follow-up for your cancer prevention. Now, that's not true. The vaccine is awesome. Don't get me wrong. The vaccine is great. Nothing is 100% though. And so we want to make sure that people are still doing their primary HPV screening thing. So for cervical cancer, that looks like your pap smear today. And then with that pap smear, we do HPV testing. So it's co-testing at the same time. That way we're able to tell you whether you've been infected by one of those HPVs that's a problem. So even if you never got a vaccine, you want to get your cancer screening. But those who got the vaccine still need to get their cancer screening. That vaccine doesn't change how often you need to come in and get your cervical cancer screening. And so if you're not sure, it's a great opportunity to have a conversation with your family doc about, am I due? If you're due, they could probably do it for you that day. Honestly, I mean, most of the time we just do them and we're done, but just know that that's an opportunity. So the vaccine is awesome, does a great job. But remember that there's also this opportunity to get screened.
That's great. No, that's great advice because I think we forget about that, right? It's a 1-2 kind of punch, right? You do the vaccine and you still need to get your screening. Well, let's kind of go back a little bit to the vaccine, right? I know you talked about some myths and misconceptions because I'm a parent. I have a 11-year-old now. She did get vaccinated and she got her first round and she's due for her second round. But, I've heard a lot of questions, right? Like, couple of them, and I'll just throw them out and we can talk about them one by one. But one of them is like, does it increase the accelerate her puberty, right? Because we're talking about the age group and when they do get the vaccine. So, and then there's other ones like, of course, the old myth about autism and links to other disorders. I mean, let's kind of, if we can talk about those and help our parents out who are kind of considering the vaccine.
I think this is such a great question. So, I mean, I know that this is the part where people expect me to fuss at all the parents for being hard-headed and asking questions. And that's the complete opposite of how I feel about it. So I love the fact that parents are thinking about their children, thinking about how to keep them safe. And certainly the last thing we want to do is to try to solve one problem by causing another problem. So that is never the goal. Vaccine safety is something that we take very seriously. At this point, we actually have over 15 years worth of data looking at side effects and unintended consequences of the HPV vaccine. It's one of the most widely studied vaccines in the world. Like, people have looked at it in so many different ways that it's almost comical to me sometimes, the studies that you can pull up when you're looking at the things that could go wrong, that people were like, that's interesting. I wonder if that's true. Let me just double check and make sure that it's not true. And the interesting part about it is that for all of those studies, they still come back to the same basic things that could happen if you get the HPV vaccine. And they're really, really like easy ones. So for example, it is very true that if you get the HPV vaccine, that you could have syncope. So if I give you the shot, it's possible that your kid might faint or pass out. It turns out that's actually true for any needle-based treatment that I would give your child in the adolescent age group. They faint more when they see needles than the rest of us. And so, like, I mean, that's just a thing. And like, we know this to be a thing, but they've actually studied it, and they do know that that's true with HPV vaccine. We know that you might get some swelling, you might get some soreness where the shot is given. There are a really, really small number of people who actually might be allergic to the vaccine, and you find that out when you give them the first dose. But it is a strikingly low number. I mean, it's low compared to even common things that we give people on a regular basis. And so you're like, okay, so I'm glad we looked, but turns out that's not a thing. And then we started to see, even where they've studied things, like there was a question at one point, will my child become more sexually promiscuous and start having sex at an earlier age because the vaccine somehow does something? They actually studied it, and the answer was no.
Wow.
That the age range that people started having sex was the same, whether they were in the group of people that got the vaccine or the group of people that didn't get the vaccine. The only difference is that one of them was pretty likely to get infected with HPV and went on to have higher risk of having cancer, and one of them didn't. So, I mean, things like, they do not find these things that you're showing up. So they did not find autism. They're not finding any issues with, impacting or causing an issue with puberty. They're not finding issues with fertility or being able to have children. I mean, the fertility one always makes me sad, because what I find is that you actually have a worse problem if you end up getting infected with HPV, because an HPV infection often creates lesions on your cervix that have to be treated. And treating those lesions often means taking biopsies. Taking biopsies means literally you're taking pieces of the cervix out to go look at it. Every time you do that, you increase your risk of miscarriage down the road, because you're damaging the cervix, like you're creating a harm. And so getting infected isn't somehow a good thing compared to the vaccine, but it turns out it doesn't even cause that in the first place. And so here, I'm not giving you the thing that could prevent the thing you're worried about, because you're worried about it happening. And it makes me frustrated a little bit, because I think that social media plays a role. And that's why I'm glad that we're here in this space, because, every time I sort of scroll through and look, for every one person who, tells their story about how getting the vaccine was helpful to them or how they haven't had a problem, there's like 100,000 other stories about how something could have gone wrong, might have gone wrong, maybe sort of coulda, or retweeting the negativity around what could have been a problem, but turns out to have been a debunked thing a long time ago. And that just makes me really frustrated, because I really hate that some people are having their decision making influenced by people who aren't telling you the truth, or who are telling you only a part of a story. So you're actually making a bad decision because of the bad information, and not because you're a bad person, and not because you're trying to be difficult or challenging, but just that the volume of information is so much bigger that's negative compared to what's positive. And it's because the people who got their vaccine just went about living their cancer-free life, and they don't feel the need to tell you about that on social media, because they're just living their life. And that makes it an open space for people who are concerned or worried to sometimes create this sort of misleading volume of information. So it looks like there's all these things going on, when in reality, it's a really small number of people with a really loud voice, sometimes sharing things with you that are just literally inaccurate and sometimes untrue.
Right. I mean, it's so important to talk about these things, because it helps dispel those myths and misconceptions, right? And as a parent, you're right. We just want to, our priority is to make sure our kids are safe and healthy. And, this is a great way to talk to, openly talk to your, if you have any concerns, right? Talk to your physician and your pediatrician, and just, talk through it, because at least you're getting the correct information from a great source, which is, pediatricians and doctors out there who know and vaccine and are experienced in this vaccine, in this vaccination era, right? And it's great. I think I talked to my daughter about it, and she knows, and she talks to her friends, and she's like, yeah, I got a shot. I mean, it hurt a little bit, as all shots do, right? As kids, right? They all, don't like it, but now she's safe. So now that we talked about the myths and misconceptions, how about we talk about the recommendations? What is the guideline right now? Because I've heard it's recently changed, right? From the 10 to 9, now it's 9. You could give it as early as 9. Is that correct? I know that it's changed recently. So could you kind of go through the guidelines right now, the current guidelines for parents?
Yeah, absolutely. So, I mean, it's interesting because guidelines don't always stay the same. And sometimes that makes people nervous. I usually remind them that actually it's a great thing that guidelines don't always stay the same, because it's yet another way that people are incorporating new studies, new data, new information, because they're constantly looking to make sure they're giving you the most up-to-date thing and that our patients, our community are getting the things they need. So some parts of it haven't changed as much as people think. It's the way that people are talking about it that sounds a little different. So even from the very beginning, we were able to give the vaccine as young as 9 years old. And most people really leaned into the idea that really, if you were 9 to 10, maybe I didn't need to do it then. And I could wait till you were 11. And the CDC's Advisory Committee on Immunization, so the ACIP, their recommendation is actually give it at 11 and 12-year-old. And the reason why is because that's when you're doing all their other vaccines at their adolescent visits. So all the other vaccines happen then. And so they just wanted to add those 2 vaccines to that visit and keep it simple. Like, you come in for your visit, you get your HPV along with your other adolescent vaccines. And so that's still their recommendation today. And what they say is you could actually still give it as early as 9. What we've heard from parents and from teens is that, you know what, it's a lot of shots to give me at one day. So yes, I appreciate you trying to coordinate it and make it so that I only had to come in once, but I might not like to have had less shots that one day. And is there a way that we might have thought about it differently? And if we had to think about it different, instead of delaying your HPV vaccine and giving it later, give it at 9 and 10, and you could still do your 11 and 12-year-old shots, and that would be totally fine. And so that's one space where people think about it. And if you listen to the American Cancer Society, they're going to tell you start at 9 and 10 because they want you to just get it in and get it done. Some of the other groups are going to say just stick with the CDC and do it at 11 and 12, but have that conversation with your doctor. If you're not sure that you want to do all those vaccines, it's better to have done the HPV one early than to have waited on the others, if that makes sense. And so that's one change. It's a little bit different. So you can certainly have it as a conversation. I think you're going to have more docs offering it to you at 9 and 10. So that if you decide that you want to do it, you can get it done. And then if you don't do it, then you still got 11 and 12 years old to make sure we catch you up. The other part that I think people are hearing that sounds a little bit different is that for a long time, the recommendation basically went all the way up to age 26, and then we sort of said, we're done. So if you didn't get your vaccine by the time you were 26, there really wasn't a chance to get HPV vaccine. And what happened is that people have done more studies, and they found that while they're still not sure that they can just sort of open-heartedly tell everybody, 27 to 45 to go get the vaccine, for reasons I'll talk about in a second, they do think that there's a value to some people for having it done at that time. And so if you're in that age group, somewhere after that 11 to 12, when they tell you to get the vaccine, all the way up to age 26, the answer is do the vaccine. Now, you might have to get a different number of shots depending on what time you start. And we could talk about that if that'd be helpful.
Yeah.
But the reality is that, like, just do it. So anywhere between 9 and 26, the answer is yes, you should get vaccinated, and you should follow the number of shots based on the age you are at the time you start the vaccine series. Once you get to 27, so from age 27 to 45, it's not quite as easy. And what they tell you is instead of just routinely throwing the vaccine at everybody, you really need to have a conversation and find out whether it's right for that particular patient. At that point, there are some folks for whom the vaccine might not be helpful anymore, or it might be less effective than it otherwise might have been. And so they may have a reason why it might not make sense for them at this point in their life to have it done. And so there's a conversation that happens. By and large, I think the majority of people who would want to be vaccinated in that age group are going to get told that it's safe and effective for them as well, and go ahead and get it done without too much of an issue. What we have to be careful about in that age group is that the HPV vaccine can't fix your problem. So if the reason why you want to get the vaccine is because you had an abnormal pap, for example, and it told you that you had been infected by a type, the vaccine can't undo your infection. And so sometimes people are wanting to get the vaccine in that older age group, but they've already gotten the infection. So the vaccine wouldn't be as effective for them as it would have been had they never been exposed at all. And that's why we push so hard to have children get the vaccine before they've ever had an exposure to HPV, because that's the time when it's likely to be the most effective. So you just have to have a conversation and make sure it's okay. And I alluded to it earlier, but there's sort of a 2-shot series and a 3-shot series. So at the very beginning, we were giving everybody 3 shots. We did a lot of study and data around whether you needed 2 or 3. And one of the things they found out is that it turns out younger kids actually have a much more robust immune response. So their body actually responds better and for a longer period of time than if you gave the shot as an adult. And so the age cutoff is 16. So if you're under 16, when you start to get your vaccine series, you only need 2 shots. If you're actually over the age of 16, you need all 3, like the original studies were showing. And so depending on when you start, you may need 2 or you may need 3. Both of them are going to give you the same amount of coverage by the end. But if you're older, you need that extra booster dose to get to where the younger kids get, and only 2. So it's actually better to do it younger. You only need 2 shots.
Right, because you only need 2, and then when you after a certain age group, then you need 3. Right. So there's a question. Do you think that I mean, after the two, right? So the two shot, do you need to like get an additional one when you get older, or are you done with the series?
Oh, that
And
is such a great question.
you don't need to get it again, right? Like what about those?
Oh, that's such a great question. You're like on it today. I love it. So no, once you start the series, you do not ever have to start it over again. So
Okay.
this is an interesting one. So if I gave you your first HPV shot at 9 years old, and then somehow you like fell off the radar screen and didn't show back up in my office until age 21, I would give you one more shot because you started your series at 9 and you get your second shot at 21 and you'd be done because the age you started was before age 16. So I only had to give you one additional shot. You need two, you're done. You don't have to come back later and get another booster or get anything else different. You're just done. If you started that same series, but you were 18 when you got your first shot, so you were over the age of 16, so you showed up at 18 and you got a shot, and then you forgot to come back or you just had other things happen and you showed back up at age 21, I'd give you a second shot, but then I'd have to schedule you for the third shot. So we don't restart back to the beginning, but you still have to get to the total number, and the total number gets decided by the age you were when you started the vaccine series. And so when in doubt, get at least one shot early. Minimum,
Okay.
worst case scenario, you get one more shot at some point in life. If you wait, not only do you increase your risk of being exposed, but you also need 3 instead of the 2, and you don't have to start it over. So if you just got the 1 and you just got frustrated with it and you wanted to wait, you're at least partly covered for part of that time. And oh, by the way, when you come back to get that other shot, you only need 1 more. So you don't have to start all over again. You don't need a booster. If you did your whole series, you don't have to come back later at age 45 to get a booster. You don't have to do any of that. That's not a thing. They are studying it to see whether or not it could be a thing in the future. So far, it's not looked like that's something that we need to do for folks. And so at this point, we're not even having to worry about that. So all you have to do is get it in time. And get the first dose in. And I just can't say this often enough. If you get it when you're younger, your immune response is just so much better that it just sticks around. And so honestly, you really only need one more booster on the other side. And so even if somehow you got delayed, you'd still only get the 1 shot. So starting earlier is better.
So that's great information because I know some parents, we forget, right? We're just kind of scheduling everything and we just kind of forget, what boosters or what's needed. So definitely that's great information. So if you just got one, that's still good. And we still need to get you the other one, depending on what year or what age group you were in at the time. Now, we remind our listeners again, and those who are tuning in, the shot is for girls and boys, not just girls. So just because girls only have the cervix, right? And you said before, it causes a whole host of other cancers, not just cervical cancer, but it is good for girls and boys, right?
Absolutely. So all of the recommendations that I've given to you are for girls and boys, men and women. And it doesn't matter your sexual orientation either. And so these are not the things that sort of impact what we're talking about at this point. So everybody has an opportunity to benefit from the HPV vaccine. Now, they started talking about cervical cancer. So if you're talking about, I just need to prevent cervical cancer, there may be a way that people might have thought, oh, well, maybe I'd only need to do it if I'm a girl because I'm the only one that has the cervix. How does that work? And the reality is that in places where both the boys and the girls get vaccinated, you reduce the amount of HPV burden in that society. There's just less of it around. And if there's less of it around, there's less of it to pass around, less of it to infect people. And so we actually think everyone gets vaccinated. But it turns out this isn't a chance where you only help the girls. I mean, over time, what they learned is that actually it does have an impact on penile cancer. It does have an impact on genital warts. And so the boys aren't just getting vaccinated to protect girls. The boys are also getting vaccinated to protect themselves. And what we know is, for example, oral pharyngeal cancer, so that mouth and throat cancer is actually even higher in men or in boys. And so we actually would like to be able to make sure that we can help them get protected. So they're doing the studies now to see whether the vaccine the current vaccine is the best effective way to prevent that type of cancer. We know it reduces the rate. We just need to see whether it prevents it at the level where it makes sense. But that's just a benefit. So we're just adding benefits to them. So everybody, boys, girls, men and women, all eligible for the vaccine.
And I love the fact that you said doesn't matter sexual orientation, because I know a lot of our listeners, if who are tuning in, have questions about sexual orientation and is it an issue? It's not. It's just it protects from cancer pretty much. And I like to say that it's not a vaccine in terms of like a cold vaccine or like the flu vaccine, right? It really does protect cancer, right? It's a cancer prevention tool. And I like saying that because I think people need to understand that this is kind of the first vaccine that we have that really prevents cancer, right? Like multiple forms of cancer.
I mean, it's really exciting. Sometimes people will say hepatitis B wins because they came out first, but the reality is that HPV's got multiple cancers. So, like, I mean, it
Right.
doesn't, either way you want to look at it. What we know for a fact is that the impact of the HPV vaccine has been tremendous in the populations where people have been vaccinated. In the countries where they did a better job of vaccinating than we've done so far in the United States, their rates plummeted. And we see that even happening, even in the population that we have, where everybody didn't get their vaccine, and we're still seeing the rates just drop. And just imagine if more people were vaccinated, we might actually be able to eliminate cervical cancer and maybe
Yeah.
all of these other HPV related cancers, just eliminate them, because there would be no infection to create this setup for the cancer to happen in the first place. And that's the kind of stuff that just gets me excited. I mean, just the idea that we could protect people, we could save their life. I mean, we forget
Right.
sometimes that it's not just a matter of inconvenience. People die from these
Exactly.
cancers, and the people who do live sometimes live with really dramatic scars that affect the rest of their life, the quality of their life. And anytime that we can prevent that, anytime that we could stop our children from having that, is even on the list of things that could happen in their life, it just seems like a win to me that we want to lean into.
Exactly. And I think that's what we said as parents, our primary goal is to make sure that our kids are safe and healthy. And this is a perfect tool to be able to do that, to ensure they're safe and healthy, moving forward. I really want to thank you so much. And I want to remind everybody, get your vaccine done. You can get it through talking to your pediatrician, your doctor, or even at pharmacies now, right? It's like easy. My daughter got hers at CVS. I mean, it was just that easy. We walked in, got our other stuff, and she got a shot, and it was just easy. So I think it's where there's so many ways of avenues of getting it. So definitely, get your vaccine. And if you have any questions, talk to your doctor, right?
Absolutely.
Perfect. Thank you so much. All right. I'm gonna